Welcome to the Nutritionist channel. Hey everyone! Welcome back to our channel. Do you know diabetes affects more than 1 in 10 people in the United States according to the CDC? It is also estimated that more than 1 in 3 of the U.S. population has prediabetes. Diabetes is a chronic disease that occurs when your blood sugar is too high. The body cannot properly convert blood sugar to energy. If left untreated, diabetes can damage blood vessels and nerves over time. On the long term, it may result in several complications, including heart disease, stroke, kidney failure and blindness. Due to the prevalence of artificial ingredients and processed foods in our diet, the number of people suffering from high blood sugar is dramatically increasing. High blood sugar is also known as hyperglycemia. You can find out if you have high blood sugar with a blood glucose test. A person has hyperglycemia if their blood glucose is greater than 125 mg per deciliter after 8 hours of fasting. For prediabetes, their fasting blood glucose is 100 to 125 mg per deciliter. It is important to be aware of the symptoms of high blood sugar so that you can seek medical attention promptly if you experience them. In this video, we will grade the symptoms of high blood sugar condition, from early symptoms to more serious long-term conditions. We will also explain the mechanisms on how high blood sugar leads to these symptoms. The following symptoms are early warning signs that your blood sugar level is starting to go unhealthy. 1. Frequent urination, polyuria. When blood sugar levels are high, the kidneys produce more urine in an effort to remove the extra blood sugar from the body. This leads to increased urination. 2. Increased thirst, polydipsia. Frequent urination causes dehydration as more body fluids are removed from the body. This leads to dehydration. Dehydration triggers thirst, which is a signal to drink more fluids. 3. Dry mouth and itchy skin. These are caused by dehydration when body fluids removed from frequent urination are not replenished. 4. Increased hunger, polyphagia. As the body cannot properly convert blood sugar to energy, the body's cells are unable to get the energy they need. This triggers the stomach to release hormones that can increase hunger, such as ghrelin. The body may still feel hungry even though it has just eaten. 5. Frequent headaches. There are a few possible mechanisms by which high blood sugar could cause headaches. As frequent urination leads to dehydration, headaches may occur if the body fluids are not replenished. High blood sugar can damage blood vessels and nerves in the body, including the brain. This damage can lead to inflammation and headaches, as well as other neurological problems. 6. Blurry vision. High blood sugar can cause irregular movement of fluids in and out of the eye. This may cause the lenses of the eyes to swell. The lens is the part that focuses light onto the back of the eye. Swelling of lens can lead to blurry vision. Next, we discuss the possible symptoms when blood sugar remains high for a longer time. 1. Constant fatigue or extreme tiredness. As the body cannot properly convert blood sugar to energy, the body's cells are unable to get the energy they need. In addition, high blood sugar can damage blood vessels and nerves in your body. The body may often need to fight off infections. As a result, the body is always in a state of fatigue. 2. Unexplained weight loss. With increasing difficulty of converting blood sugar into energy, the body is unable to get the fuel it needs. As a result, the body starts to break down fats and muscle tissue for energy, which can lead to weight loss. Dehydration from frequent urination may be another cause of weight loss. 3. Darkening of the skin around the neck, armpits, and groin, acanthosis nigricans. Acanthosis nigricans is a condition that causes the skin to become thicker and darker. It is often seen in people with high blood sugar levels. The exact mechanism of acanthosis nigricans is not fully understood, but it is thought to be caused by the overproduction of insulin. 4. High cholesterol and triglyceride levels. High blood sugar can cause the liver to produce more cholesterol and triglycerides. These are types of fat that can build up in the arteries and increase the risk of heart disease and stroke. 5. Low HDL cholesterol levels. HDL cholesterol is known as good cholesterol because it helps to remove LDL cholesterol, or bad cholesterol, from the arteries. High blood sugar levels can decrease HDL cholesterol levels. 6. High blood pressure. High blood sugar can damage the blood vessels in the kidneys. This damage can make it harder for the kidneys to filter waste products from the blood. When waste products build up in the blood, they can raise blood pressure. On the long term, high blood pressure increases the risk of heart disease, stroke, and kidney failure. 7. Slow healing sores and cuts. High blood sugar can damage blood vessels, which can reduce blood flow to the skin. This can make it difficult for the body to heal wounds. 8. Frequent infections. High blood sugar can weaken the immune system, making it more difficult for the body to fight off infection. This can lead to more frequent infections, such as urinary tract infections, skin infections, and pneumonia. 9. Numbness or tingling in the hands and feet. High blood sugar can damage nerves throughout the body, including the nerves in the hands and feet. This can lead to numbness, tingling, and pain. Other related symptoms include cramping in the feet, poor reflexes, and poor balance or coordination. 10. Erectile dysfunction in men. High blood sugar can damage blood vessels in the penis, making it difficult for blood to flow into and out of the penis. This can lead to erectile dysfunction. Next, we discuss the risks of critical and permanent harm that can happen to the body if high blood sugar is not treated for a long time. 1. Amputation. Weakened immune system may make the body more susceptible to infections. At the same time, when blood vessels and nerves are gradually damaged, there may be a gradual loss of sensation in the toes and feet where ulcers and wounds may develop unnoticed. If left untreated, affected tissues will die off, causing infection and gangrene to spread. Amputation is needed when the infection becomes life-threatening. 2. Eye disease, diabetic retinopathy. The most common eye disease caused by high blood sugar is diabetic retinopathy. This is a complication of diabetes that affects the retina, the light-sensitive tissue at the back of the eye. Over time, high blood sugar can damage the blood vessels in the retina, causing them to leak fluid or bleed. At the last stage of the disease, it can lead to permanent blindness. 3. Kidney failure. Over time, high blood sugar can damage the blood vessels in the kidneys, making it difficult for them to filter waste products from the blood. This can lead to a buildup of waste products in the blood, which can eventually lead to kidney failure. Late-stage kidney failure may be life-threatening. 4. Heart disease. People with diabetes are at an increased risk of developing heart disease, even if they have no other risk factors. High blood sugar can damage the blood vessels throughout the body, including the blood vessels that supply blood to the heart. This damage can lead to a number of heart problems, including coronary artery disease, heart attack or heart failure. 5. Stroke. High blood sugar can damage the blood vessels that supply blood to the brain. This damage can lead to a number of problems that can increase the risk of stroke, including hardening of the arteries, atherosclerosis, high blood pressure and blood clots. Conclusion. High blood sugar is a serious condition that can lead to a number of complications. It is important to be aware of the symptoms of high blood sugar so that you can seek medical attention promptly if you experience them. With proper management, high blood sugar can be controlled and the risk of complications can be reduced. If you found this information valuable, please consider liking and sharing this video with your friends and family. Subscribe to our channel for more insightful content on nutrition, health, and well-being. Thanks for watching.